Transfuse 2016. It's a 3-day conference where we're going to be bringing in a slew of experts from anesthesia, surgery, transfusion medicine specialists, nursing, to really come together and talk about what are the latest advances for transfusion protocols, the evidence-based research for how we should transfuse patients, and talk about really what's on the frontier for transfusion. Collaboration is huge for patient blood management. It really takes the surgeon, the anesthesiologist, the hospitalist, everybody to put their heads together in order to weigh what is going to be beneficial to this patient. Is the patient going to benefit from a transfusion? Is the patient really going to benefit from effector concentrates? In medicine now, we each have a different perspective of the patient. And so patient blood management is all about bringing together everybody across the medical spectrum to understand what's going to be that best decision for the patient. We're going to have some interesting sessions, some interesting breakout sessions and large group sessions about pathogen reduction technologies and what's going to be the impact on that for patients, as well as what are the new protocols and new recommendations and the science behind it for taking care of the transfused patient. Really, all medical providers involved in transfusing patients should attend, from nurses to pathologists to surgeons to anesthesiologists to hospitalists to anybody who's going to be involved with the patient. This conference is really about sharing this knowledge that's unique to this group and to really disseminate what best practice is in this country and across the world. So we're going to be particularly focused on caring for the surgical patient as well as the medical patient. So how do we address hemostatic challenges or risk for a hemostatic challenge? We're also going to be taking a look at pathogen reduction technologies and extrapolating on what that's going to mean for patients in the future. So we're also bringing in some really interesting presentations. We have an expert coming in to address the ethics of blood transfusion, as well as we're going to have myself, a pathologist transfusion specialist, and a surgeon kind of duel out, some of the ethics regarding this how do we use this limited vital resource.